Good afternoon. I'm Dr. Elizabeth Tuyakula Amadhila. I'm a medical officer at the Intermediate Hospital of Shakati in internal medicine. I'm working at a state hospital. So Intermediate Hospital of Shakati is a referral hospital in the northern part of Namibia. I undertook a postgraduate diploma in endocrinology under the Merck Foundation nationwide hypertension and diabetes Blue Points program. Merck Foundation, doing this course through Merck Foundation was a dream come true because we have very few specialists available at our hospital, and we hardly have any endocrinologists. Throughout my varsity days, internship, and of course, as a medical officer, I've never come across an endocrinologist. However, we are still getting patients who had endocrinological disorders. So with this information, I noticed that there was a knowledge gap in endocrinology. So I decided then to do this postgraduate diploma in endocrinology, which was on an online platform. This was amazing because then I was still able to continue helping my people, my patients, at work, while of course undertaking this online program. So it was easy for me, and of course I learned a lot. I gained a lot of knowledge from that program. So the course content was comprehensive enough. I learned, what I said earlier, I really learned a lot. Of course, the course content came from covering anatomy, including embryology. So it was a good revision also to the med school days. Took us back to the good med school days. Of course, it also embarked on now the clinical aspect, seeing patients on day-to-day basis. So the course had a positive impact. Then and of course today, because with the knowledge that I gained from that course, I've been able to teach my fellow colleagues, teach interns that are under us, teach medical students, and also manage endocrinological diseases effectively. So just as an example, we actually had a patient, a 34-year-old female. So she was diagnosed with hypertension in 2014. And unfortunately, because of this hypertension, she has been getting a lot of preeclampsia, which is severe hypertension in pregnancy with some complications. So she had so far 2 previous miscarriages because of the chronic hypertension, and she also have had 2 termination of pregnancies because of this chronic hypertension with superimposed preeclampsia. So then this year, around June, we got called in again. She was pregnant at 18 weeks with very high BPs in a hypertensive emergency actually, and unfortunately had suffered a missed miscarriage yet again this year. So because of the knowledge that I got from the postgraduate diploma in endocrinology, I noticed that she actually had a mild hypokalemia of just 3.2, which under normal circumstances is not something that can really worry you, because you think, oh, it's just mild hypokalemia. But because of the course that Merck Foundation funded, this triggered what I learned, which was even mild hypokalemia with hypertension, remember primary hyperaldosteronism. So we started working her up for the primary hyperaldosteronism, and indeed it was confirmed. The results came back earlier this month, and indeed she really has a primary hyperaldosteronism, and we started her on the mineralocorticoid receptor antagonist, and she's doing quite well now. So for someone who suffered all those miscarriages, has been having with this refractory hypertension for the past close to 10 years, and couldn't be really properly be managed because of course of resources and of course lack of knowledge here and there. With the knowledge that we got from this Merck Foundation, me being able to also teach my colleagues and the interns, we were able to come up with this diagnosis, and the patient's life was positively impacted. So yes, it was a very good course, and I hope everyone else gets a chance to get to do a course with Merck Foundation. It's free for us, but of course with so much positive outcomes. Cases that we had was just the one we mentioned, of course, among many. Other ones were patients, of course, young patients coming in with refractory hypertension, and then they actually have features of Cushing syndrome, and then you end up actually waking them up for the Cushing syndrome, and they get confirmed. We wouldn't really have that high index of suspicion if it wasn't because of the sensitivity that we got because of the course. I 100% would encourage anyone to do this course, especially through the Merck Foundation. It's knowledge literally at home. You're most comfortable in your comfort zone. All you need is just a laptop and Wi-Fi, which are widely available, and you can get all this information. So, and learn, and with this, only through knowledge that we can actually positively impact the healthcare of our people, and we have to equip ourselves with the knowledge as healthcare workers. So I 100% recommend anyone to do these courses. To Merck Foundation, I would just like to appreciate Merck Foundation for this positively impacting program, especially to be in Africa, with many patients, with limited resources. This kind of programs really allow us to gain the knowledge that we need to still care for the patient. So thank you very much, Merck Foundation. May you continue to do this. It's a very great initiative. Thank you.